You went to bed last night feeling completely fine. No warning signs, no chest tightness, no reason in the world to think anything was wrong. And while you were lying there in the dark, eyes closed, body still, your brain may have been quietly starving for oxygen, not because of a hidden disease, not because of anything a blood test would catch, but because of the exact position your head was resting in when you drifted off. Stay with me on this, because what I am about to walk you through has nothing to do with your diet, nothing to do with how much you exercise, and almost certainly nothing your doctor has ever brought up in any routine checkup you have ever had. This is about something you do every single night of your life, something so automatic and so ordinary that it has never once crossed your mind as a potential risk. And yet the research tells a different story entirely, one that is quietly playing out in bedrooms all over the world while people sleep. Before I get into it, I want you to do something. Think about the position you woke up in this morning. Think about where your head was, which direction your body was facing, whether your neck was straight or twisted slightly to one side. Hold that image in your mind, because by the time you finish reading this, you are going to look at that image very differently. You are going to understand, maybe for the first time, that the hours you spend unconscious are not neutral hours. They are not a pause in your health story. They are some of the most consequential hours in your entire day, and most people are spending them in positions that are working quietly against them. Here is the piece of information that tends to stop people cold the first time they hear it. Stroke risk does not go down while you sleep. In fact, it peaks in the early morning hours, climbing as much as 49% between the time you wake and noon, driven largely by what researchers call the morning blood pressure surge, a natural spike in cardiovascular pressure that occurs as your body transitions from sleep to waking. That surge is normal. That surge is expected. But what determines how dangerous it becomes depends almost entirely on what your body was doing in the hours before it arrived. The quality of your overnight blood pressure regulation, the efficiency of your circulation, the amount of oxygen reaching your brain tissue during sleep, all of it feeds directly into how vulnerable or how protected you are when that morning window opens. Which means the way you sleep is not just a comfort issue, it is a cardiovascular issue, and for people over 60, it is one of the most underestimated risk factors in modern medicine. Now, to understand why position matters so much, you need to understand what changes as the body ages, because this is not the same conversation for a 35-year-old that it is for someone in their 60s or 70s. When you are young, your blood vessels are elastic and responsive. They stretch, they adapt, they compensate for pressure changes almost instantly. You can sleep in a strange position, wake up with a stiff neck, take a hot shower, and move on. Your cardiovascular system has already quietly corrected for everything. But after 60, the arterial walls begin to stiffen. The small vessels feeding your brain lose some of their flexibility. The system your body uses to regulate blood pressure at night, a system that in healthy sleepers produces a natural 10 to 20% pressure drop called overnight blood pressure dipping, becomes slower and less precise. That natural dip is protective. It is your body recovering, rebuilding, clearing, but it depends on conditions being right. It depends on your sleep position not interfering with the vessels and pathways that make it possible. When those conditions are disrupted, the dip does not happen properly. And what fills that gap is cardiovascular strain that accumulates night after night in silence. That is the framework. Now let us talk about what is actually going wrong, and the first culprit is one almost nobody suspects. Sleeping completely flat sounds like the right thing to do. No elevation, body perfectly horizontal, spine seemingly aligned. Mattress companies have built entire marketing campaigns around the idea of the flat, neutral sleep surface. But here is what they are not telling you. When you lie completely flat, particularly after 60, blood does not distribute through your body the same way it did when you were younger. Without gravity gently assisting the drainage of fluid away from your skull, cerebrospinal fluid, the liquid that cushions and protects your brain inside the skull, can build pressure. Intracranial pressure edges upward, and the tiny, already slightly aged vessels inside your brain are now dealing with that elevated pressure for 7 or 8 hours straight. Research published in the Journal of Clinical Sleep Medicine found that even a modest elevation of the upper body, as little as 15 degrees, produced measurable improvements in intracranial pressure and in the dynamics of nighttime blood flow through the brain. Now, here's the part most people brush off entirely. You wake up at 3 in the morning with a dull, throbbing ache, usually behind your eyes or at the base of your skull. You tell yourself it is dehydration. You tell yourself you are getting older, and headaches just happen. You get a glass of water, maybe take something for the pain, and go back to sleep. But what if that headache is your brain sending a very specific signal that pressure inside your skull has been building for hours and has finally crossed a threshold your nervous system cannot ignore? What if the thing you have been treating as a minor inconvenience is actually a message that deserves to be heard? Hold on to that question because it connects to something even more significant that I am going to explain shortly. The next mistake surprises nearly everyone because on the surface, it seems completely harmless. Sleeping on your stomach. You are not putting weight on your heart. You are not obviously compressing anything important. You are just lying face down. What could possibly go wrong? The answer is your neck. And what happens to it when it is rotated for 8 hours straight every single night? When you sleep face down, you physically cannot breathe with your face pressed into the mattress, so your head turns to one side. And because human beings are creatures of deep habit, it turns to the same side every single night, typically rotated anywhere from 45 to 90 degrees for the entire duration of sleep. Running along each side of your cervical spine are two vessels called the vertebral arteries. These are not minor vessels. They carry blood directly to your brain stem, your cerebellum, and the regions of your brain responsible for coordination, balance, and the automatic regulation of your breathing. When your neck is rotated severely and held there for hours, those arteries can become compressed and kinked, much like stepping on a garden hose. The flow does not stop entirely, but it becomes restricted. And restricted blood flow to your brain stem, accumulating night after night over months and years, is not something the body simply absorbs without consequence. Research confirmed that extreme rotation of the neck measurably reduces blood flow velocity through the vertebral arteries, and the anatomical principle applies directly and completely to sustained sleep positions. There is also a second problem with stomach sleeping that runs underneath the first one without most people ever realizing it. When you lie face down, your rib cage is pressed against the mattress. Every single breath you take all night long is a breath working against compression. Your diaphragm cannot fully descend the way it is designed to. You never reach the complete deep breath your lungs are capable of drawing. This means every breath delivers slightly less oxygen than it should. When you combine restricted blood flow to the brainstem with reduced oxygen per breath and hold both conditions steady for 8 hours every night, you are creating a slow, invisible accumulation of neurological stress. In a younger body, compensation happens easily. In a body over 60 managing any degree of hypertension or cardiovascular history, the math becomes more serious than most people want to sit with. Now, here is something that sounds contradictory. The next mistake is one that people make while genuinely trying to solve a problem. And in solving it, they quietly create a worse one. Stacking multiple pillows under your head. People do this for legitimate reasons: acid reflux, sinus drainage, snoring, difficulty breathing lying flat, and a small degree of elevation does genuinely help some of those things. But when the elevation becomes excessive, when your head is propped up on 2 or 3 pillows and your chin is being pushed toward your chest, a cascade of pressure problems begins that most people never connect to anything they are actually experiencing. The forward bend of the neck compresses the same vertebral arteries we were just discussing, but now from the front rather than the side. It also compresses the internal jugular vein, which is your brain's primary drainage pathway, the vessel responsible for carrying deoxygenated blood back down from your brain toward your heart. When that vein is partially obstructed, blood drains less efficiently from your skull. Pressure inside the cranium builds slowly over the course of the night. Your brain's ability to clear metabolic waste during sleep becomes compromised. And in the morning, this shows up not as pain, but as fog. A heaviness behind the eyes. That frustrating, disorienting feeling of waking up after 8 full hours and still not feeling remotely rested. Many people assume this means they need more sleep. What it may actually mean is that the sleep they are getting is not draining properly because the position their neck is in all night is blocking the exit. The fix is almost embarrassingly simple. One pillow, one properly contoured pillow that supports the natural curve of your neck without forcing your head into any artificial angle. A memory foam cervical pillow is ideal because it maintains the curve rather than flattening it. Many people have reported that morning headaches they had been living with for years disappeared within a week of making this single change. Not medication, not a new diagnosis, one pillow. Now we get into territory that is going to reframe something many people believe is actually good for them. Side sleeping is widely considered one of the healthiest sleep positions, and in many respects it is. But the direction you face while side sleeping carries consequences that almost no one is warned about, particularly for people with any cardiovascular history. Your heart sits slightly left of center in your chest, and it has a natural orientation built around that position. When you sleep on your right side, gravity pulls your heart gently away from its optimal resting geometry. More critically, the inferior vena cava, one of the largest veins in your entire body, runs along the right side of your spinal column. This vein has one essential job, which is to return blood from everything below your waist back up to your heart. When you lie on your right side, your body weight compresses the region around that vein and restricts the return flow. Your heart, now receiving less blood from below, has to pull harder to fill its chambers properly with each beat. For a young, healthy cardiovascular system, this is compensated for without effort. But for someone in their 60s or beyond who is managing borderline heart function or chronic high blood pressure, the heart is already operating closer to its ceiling. Adding nightly resistance to the blood return system is the cardiovascular equivalent of running an engine slightly harder than necessary every single night for years. Research found that patients with heart failure overwhelmingly and instinctively avoided right-sided sleeping, often without consciously understanding why. Their bodies had already detected the strain and made the adjustment before their minds had a reason to. That instinct is worth taking seriously, even if you have not yet received a formal diagnosis. The next mistake is the one that feels most natural of all, which is exactly what makes it so easy to overlook for decades. The fetal position, curled on your side with knees pulled up toward your chest, shoulders rounded inward, chin tucked down. For many people, especially women over 60, this is the position the body automatically assumes. It feels warm, it feels safe. There is something deeply instinctive about it. But underneath that comfort, three things are going wrong at the same time. First, your lungs cannot fully expand. The rib cage is curved inward, and every breath across the entire night is shallower than your body actually needs. Blood oxygen saturation drops incrementally with each breath, and those drops add up across 7 or 8 hours in ways that register in brain tissue. Second, the blood vessels running through your hip joints and the back of your knees are being bent and partially compressed. Circulation to and from your lower limbs decreases. If you already experience swollen ankles or poor leg circulation, this position is consistently making both worse every single night. Third, your neck is in flexion, and everything discussed about drainage and arterial compression applies here as well, expressed across the whole body rather than at a single point. Research has documented that sustained spinal flexion during sleep produces measurable reductions in breath depth, and when you multiply even a modest reduction across every breath in an 8-hour night, you are talking about significantly less oxygen delivered to brain tissue that is already working with less reserve than it had 20 years ago. A body pillow in front of you and a pillow between your knees allows the position to open slightly without the body losing the sense of security it finds in that curl. Small shifts, compounding benefits over time. But there is one final mistake, and this one does not involve your position at all. It involves something you almost certainly do not think of as a sleep issue because it happens hours before you get into bed. Late eating and alcohol close to bedtime. Here's the scenario. Dinner finished around 7:30, a glass of something to unwind while watching television, in bed by 10. For millions of people over 60, that is a perfectly ordinary evening. But here is what is unfolding inside the body while that person sleeps. After a large meal, the body reroutes significant blood volume toward the digestive system. In younger bodies with elastic arteries and fast responses, this redistribution is managed seamlessly. In older bodies where arterial flexibility has declined, this shift can create transient drops in blood flow to the brain, brief windows where the brain is subtly undersupplied. Now introduce alcohol. Alcohol widens blood vessels, causing blood pressure to fall. The body senses the drop and compensates by constricting vessels and pushing pressure back up. Then the alcohol continues to metabolize and pressure shifts again. This produces a pattern of blood pressure oscillation all through the night, rising and falling in vessels that are already dealing with some degree of stiffness or fragility. Research found that even moderate alcohol consumption within 3 hours of sleep disrupted the natural overnight blood pressure dip that healthy sleepers depend on for cardiovascular recovery. Without that dip, the heart and blood vessels do not get the recovery window they need, and the stress that should be unwinding is instead sustained across the darkest hours of the night. This is the moment that shows up in a very recognizable way. You wake at 2 in the morning, heart beating harder than it should, sweating slightly, unable to immediately identify why you are awake. You assume it was a vivid dream or the temperature in the room. But what may have actually happened is that your vascular system just navigated a pressure fluctuation it was not fully equipped to handle, and the jolt of that recalibration pulled you out of deep sleep at the exact moment your brain most needed to stay there. The recommendation is to stop eating at least 3 hours before lying down, and if you drink alcohol, to stop 4 to 5 hours before bed. A 15-minute gentle walk after dinner, not exercise, just quiet movement, accelerates digestion and gives your cardiovascular system a chance to settle before you go horizontal. These are not dramatic changes. They are timing adjustments that your body will begin registering within a few days. Now, having gone through everything that can go wrong, it is worth spending equal time on what can go right, because there are 2 positions that research consistently points toward as genuinely protective of brain and heart health during sleep, and understanding why they work will change the way you think about every night going forward. The first, and most strongly supported by the evidence, is sleeping on the left side. When you lie on your left side, gravity works in alignment with your heart's natural anatomical position. The inferior vena cava, the large vein that returns blood from your lower body, runs on the right side of the spine and is completely free from compression when you sleep on the left. Blood flows back to the heart effortlessly. The heart fills easily. Each beat requires less effort. Over the course of a night, and then over months and years, that reduced cardiac workload compounds into something meaningful. But the discovery about left-side sleeping that genuinely shifted how sleep researchers think about position goes deeper than circulation. About a decade ago, scientists identified something called the glymphatic system, the brain's overnight cleaning crew. While you sleep, cerebrospinal fluid pulses rhythmically through the spaces between your brain cells, flushing out metabolic waste products including amyloid beta and tau proteins, the same proteins found in excessive quantities in the brains of people with Alzheimer's disease. This clearing process is not optional. It is one of the most critical things your brain does, and it happens almost exclusively during sleep. A landmark study published in the Journal of Neuroscience found that this glymphatic clearance is most efficient when you sleep on your side, and that the left side appears to offer slightly better drainage geometry due to the brain's natural asymmetry and the directional dynamics of cerebrospinal fluid flow. What this means in plain terms is that left-side sleeping is not just about tonight's circulation or tomorrow morning's headache. It is about whether your brain is systematically clearing the molecular debris that, over decades, accumulates into cognitive decline. Every night spent in a position that compromises that system is a night the waste stays behind. If you have never been a side sleeper, the transition is more manageable than most people expect. A full-length body pillow in front of you gives your top arm and knee somewhere to rest, which prevents the body from rolling forward. A pillow between your knees keeps your spine neutral and removes the hip pressure that makes side sleeping uncomfortable for many people. Give this position 7 consecutive nights before deciding anything. The body adapts faster than you would predict, and the difference in how you feel in the morning can be noticeable within that first week. For those who genuinely cannot tolerate side sleeping, whether because of shoulder arthritis, joint pain, or simply decades of back sleeping that the body has organized itself around, there is a second position that research supports strongly: back sleeping with a meaningful elevation of the upper body, somewhere between 15 and 30 degrees. The critical detail here is that this is not the same as stacking pillows under your head, which, as we discussed, creates the neck compression and drainage problems that worsen everything. The elevation needs to involve the entire upper torso rising on a gradual incline. A quality wedge pillow achieves this. An adjustable bed frame achieves it even more precisely. When the whole upper body is elevated rather than just the head, gravity assists blood return from the lower body toward the heart. Intracranial pressure is naturally reduced because fluid drains more efficiently away from the skull, and the airway stays more open throughout the night, improving oxygen delivery across every sleep stage. Adding a small pillow under your knees to maintain the natural curve of the lower spine distributes pressure evenly across the entire body so that no single vessel or joint is carrying disproportionate strain across those hours. There are also environmental factors that most people have never considered as cardiovascular variables at all. The temperature of your bedroom is one of them. Research consistently points to a range between 65 and 68 degrees Fahrenheit as optimal for adults during sleep. A cooler environment prompts your core body temperature to drop, and that drop is one of the primary triggers for entry into deep, restorative sleep. It also naturally supports the reduction of nighttime blood pressure. When a bedroom is too warm, the heart rate stays slightly elevated. Deep sleep stages become shallower and shorter, and the recovery that deep sleep is supposed to provide simply does not happen with the same quality. Light exposure after 9 in the evening, particularly the blue spectrum light from phones and tablets, suppresses the hormone that governs your sleep timing and delays the brain's transition into deep sleep. Every hour of compromised deep sleep is an hour during which the brain's waste-clearing system operates below capacity. The connection between screen use before bed and long-term cognitive health is more direct than most people realize, and it runs through exactly the glymphatic pathway discussed earlier. Noise is another variable that most people dramatically underestimate. Sounds that are not loud enough to fully wake you still interrupt deep sleep through brief spikes in arousal that cause momentary increases in heart rate. Your vascular system notices every single one, even when you do not. A white noise machine or simple earplugs can eliminate this variable almost entirely for a very small investment. One additional tool worth considering is an overnight pulse oximeter, a small clip that sits on your finger and continuously tracks your blood oxygen saturation while you sleep. If your oxygen regularly drops below 92% during the night, that is a data point your physician needs to see. It can indicate sleep apnea, circulatory insufficiency, or early respiratory compromise, all of which carry real stroke risk implications, and all of which are treatable once identified. The device costs very little and provides information that a standard daytime checkup simply cannot capture, because the events it reveals only happen when you are horizontal and unconscious. Here is the thing that matters most. Your cardiovascular system does not clock out when you fall asleep. It does not enter a protected, low-risk state simply because you are unconscious. The hours between midnight and early morning are in many ways the most demanding hours in your body's daily cycle. And the position your body is in during those hours, the temperature of your room, the angle of your neck, whether your brain's drainage system can function without obstruction, all of it is directly within your control starting tonight, not next month, not after a specialist appointment, tonight. You do not need to change everything at once. Choose one thing. If you are a stomach sleeper, try your left side with a body pillow tonight. If you go to bed within an hour of finishing dinner, move the meal 3 hours earlier and watch what happens to your mornings over the next week. If you have been sleeping on 2 or 3 pillows, replace them with one contoured pillow and notice whether the heaviness behind your eyes is any different when you wake. None of these changes require a prescription or a referral. Each one of them applied consistently represents a nightly intervention that builds on itself over weeks and months and years in ways that show up in how clearly you think, how well your heart performs, and how fully your brain cleans itself while you sleep. The quiet hours are not passive. They are working either for you or against you every single night. Now you know enough to make them work in your favor. And there is one more layer to this story. one that picks up precisely where sleep ends and morning begins, because the first 20 minutes after you open your eyes contain signals the body sends during the transition out of sleep that most people either miss entirely or dismiss as ordinary stiffness. These signals are not random. Researchers in cardiology have begun mapping them as early indicators of cardiovascular and neurological stress that accumulated during the night, appearing in the body before any standard test would catch them, dismissed every morning by millions of people who were never told what they were actually looking at. That conversation changes how you read your mornings entirely.